Let's talk about how doctors check up on your heart and blood vessels. Basically, how they figure out if your cardiovascular system is healthy. There are a few key things they look at. First up is blood pressure. This is just a measure of how hard your blood is pushing against the walls of your arteries. It's usually given as two numbers. The top one, systolic, is when your heart beats, and the bottom one, diastolic, is when your heart is resting between beats. A typical reading is around 120/80 mmHg. Next is heart rate, which is simply how many times your heart beats per minute. For most adults, a normal resting heart rate falls between 60 and 100 beats per minute. If you're an athlete or in really good shape, your resting rate might be even lower. Cholesterol levels are another biggie. Blood tests can tell you your total cholesterol, LDL, which you might hear called bad cholesterol, HDL, good cholesterol, and triglycerides. Keeping these numbers in a healthy range can cut down your risk for things like clogged arteries and heart disease. Doctors also keep an eye on your blood glucose or blood sugar. If your blood sugar is high for a long time, it can damage your blood vessels and raise your risk for heart problems. Tests like fasting blood glucose and HbA1c help track this. Body mass index, or BMI, is a simple calculation based on your height and weight. It helps figure out if you're in a healthy weight range. A higher BMI can mean a higher risk for heart disease. Then there's the electrocardiogram, or ECG/EKG. This test records your heart's electrical activity and can spot things like irregular rhythms or signs of a past heart attack. An echocardiogram is like an ultrasound for your heart. It shows doctors how your heart and its valves are working and can catch problems with the heart structure or how well it pumps. You might also hear about a cardiac stress test. This one checks how your heart handles exercise, usually while you walk or run on a treadmill. Sometimes doctors use imaging to get an even better look. Finally, there's C-reactive protein, or CRP. It's a marker in your blood that shows if there's inflammation in your body. Higher levels can mean a greater risk for heart issues. All these measurements help doctors get a clear picture of your heart health. Whether they look at them one by one or together, these tests help spot problems early and guide the best ways to prevent or treat heart disease. If you're at risk or already have a heart condition, keeping tabs on these numbers is especially important.